Hello and welcome to Module 7C of the Bucket Ministry Training Series. In this module, we are going to be discussing how to complete a survey on a recipient of the bucket filter on the initial distribution using the Survey 123 app. So in this case, hopefully you've gone through the previous modules and you've logged into Survey 123, you've downloaded the surveys to the application, and now you're ready to actually collect a survey. So we want to open that application and get to this screen that you see right here with the two surveys listed. So in this case, we are going to focus on TBM distribution and follow-up. And this is really where you're going to spend most of your time. So I'll go ahead and click on that and open that up. And the next thing you're going to see is it's going to say TBM distribution and follow-up. And then down on the bottom here, you're going to see a button that says collect. And that means obviously collect a new survey. So I'm going to want to click on collect, and it will load that survey. Now automatically you can see the survey come up, and it's very, very easy to use. But I want to unpack each one of these sections a little bit at a time so you understand how to collect the information. First of all, there's going to be certain questions that have a red asterisk after it. And that means that those questions have to be answered in order to complete the survey. If they're not answered, the survey will not save and will not be allowed to be completed. So the first one that you're going to see is the location, and that is the GPS location. Now, you can see by this little signal right here in the upper corner, which is like a satellite flashing, that that's an indication on this Samsung tablet that I'm using that it is within GPS signal and it's collecting the actual location. So in this particular case, you can see that the latitude and longitude is right here, and a map will show up, which is actually a map of the Bucket Ministry office in Rockwall, Texas. So when you're working in the field, you probably will not see this map, but you will see the latitude and longitude numbers show up there. Now, if it does not show up, and I have an example here, this is another tablet that it has not located the GPS yet. So it says no location or position source closed error, which means that it cannot find the GPS location. So in some places where we work, the interference with a roof or with other buildings makes it so the GPS chip cannot find the actual location. So we have to, in some cases, move closer to a window or step outside briefly and let the device find the location, and then you can step back inside the building. This sometimes presents a little bit of a challenge in the field, and but we just have to find a workaround, because having the GPS location is very important to collecting the information that we're trying to collect. So the next section on this form is form type, and there's two options. First option is distribution, second option is follow-up. Pretty self-explanatory, but distribution involves handing out buckets to new recipients, and follow-up is pretty straightforward, but it means the actual following up of a recipient of the bucket filter in their own home and checking how they're doing with it. So in this case, we're going to sample and do a distribution. So the next question is informed consent. It says, has the informed consent discussion occurred? And we're going to assume that that is a yes. If you have any questions on informed consent, please go back and re-watch Module 7 as we discuss what informed consent is in that module. Next section is barcode filter ID. So you have two options to get the barcode filter information in the survey. And every filter needs to have a barcode on it. They do not come from the manufacturer with barcodes. We add those separately. So you will need a barcode to be able to conduct the survey. And this barcode is what tracks the recipient family all the way through the process. So we need this barcode information if we're going to compare their survey from their initial distribution to their surveys from follow-up visits, so we can determine if there's been physical health changes and spiritual health changes. So first of all, we have two options here to get the barcode filter ID. We can scan it with a scanner, and I will tell you that some of the Samsung tablets are a little bit finicky with scanning the barcodes, and that's something that we're working on right now, and we hope to have a solution very soon. But the second option is that you can always write the barcode filter number in here, just like you see now. So in this case, this barcode is SA001231, and we want to enter the barcode filter ID the same way that it is on the barcode. So I'm going to type SA using caps, and I'm going to put 00 in. Now it's very important that you put zeros and not O's where it is noted that they are zeros, because it will cause a little bit of a challenge for us in keeping that family's information all together. So it's SA0012, and then it's 31, and that's the barcode filter ID. It's good to double check that. Now the next thing that we're going to type in here, which is required, is what type of distribution is this? Is this a group distribution? Have we gathered an entire village together and we're going to hand out buckets to every home in that village? Is this an individual distribution? Are we going home by home distributing the bucket filters? And then is this an orphanage or is this a school? And we have specific questions related to each one of those as well. So in this case, I'm just going to click that this is a group distribution, and our next question that's required is partner organization. So we can click on that, and we will see that there's a variety of different partner organizations in there. So if you do not see that your organization is listed, please let us know as soon as possible so we can get that added. But in this case, I'm just going to assume that it's going to be the bucket ministry, so I clicked on that. And the next question that's required is the country. And again, we have a variety of countries listed on here that you can scroll and find the country that you're working in. In this case, I'm going to click Brazil. Again, if you do not find the country that you're working in, please let us know as soon as possible so we can get that loaded. Next question is name of village. And make sure you agree on the spelling of the community or this village name. That has been a challenge in the past, so just make sure you agree on the spelling. In this case, I am just going to type in test, just so you can see how this works. The next question is date and time. Now, we do not care about the time that the survey is taken. We're more focused on the date. So just make sure that it's got the correct date in there. If not, you can go in and you can change that appropriately. The next question is name of person conducting the survey. And we just need the first or the last name of that person. So again, I'm going to type in test. The next question, and it's not a required question, but we really like to see that we have this question answered, is name of the village leader, president, or chief contact. And this is important because when you go back for follow-up. It might not be the same person that collected the information in the beginning, and we may need a contact to go back and initiate those relationships when we go back to visit the recipients in a few days for a follow-up. So in this case, I'm just going to go ahead and type in test. Now, the next question is there a church in this village? If it's no, it's pretty self-explanatory. But if it's yes, you will see a denomination list pop up, and I just want you to list out the churches that are in the village for the survey that you're taking. So let's say it's going to be a Baptist and a Methodist in the same village. Our next question is last name of the homeowner. We do not need their whole name. We just need their last name, please. And so in this case, again, I'm going to put in test. Our next three questions relate to age and numbers of people living in the home. And this is very important because we want to identify obviously the actual age of the recipients of the water filter and the health changes that are experienced in the process of receiving a bucket filter. So the number of adults 18 and older living at the home at least 2 weeks per month. In this case, I'm just going to put in 2. Number of children age 5 to 17 living in their household during the last 2 weeks. Again, I'm going to put in 2. And number of children 4 years or under living in your household during the last 2 weeks. So in this case, I'm going to put in 1. All right, now our next question is, what is the water source? And the water source, we want to note specifically where is their drinking water coming from. And if it's multiple sources, you can click multiple options. One thing I would like you to note is if you click purchased, if they have to buy their water to drink, I want you to type in how much does that water cost them per month in the local currency. Don't worry about converting it into American dollars. Just put it in the local currency, how much they're spending per month. So in this case, let's say they're drinking from a river and rain catchment. You can click multiples, just like I said. Now, what health issues has the family experienced in the last 2 weeks? Now, this is for the entire family. Obviously, you're going to be asking one person these questions, but we want them to answer for the entire family. So you want to know, has anyone had runny stomach, which is diarrhea, in the family in the last 2 weeks? Cough, sore throat, skin rash, same deal. Or if there's no symptoms, click no symptoms. But in this case, let's say they've had runny stomach and a sore throat in the last 2 weeks. Now the next question is not required, but I want you to ask this question, and it's very, very simple, but I need to explain it. I want you to ask, have you been diagnosed with any of these health issues in the last 2 weeks? And these health issues are waterborne diseases. But the important part here is this is a formal diagnosis that we're asking for. And this would be from a medical professional, which would be a doctor, a nurse, some other sort of clinician. And it's not self-diagnosed. So if they've had typhoid before and they think they have it again, that does not count, and it should be left blank. But in the last 2 weeks, if they have received a formal diagnosis for E. coli, Giardia, amoebic dysentery, typhoid, cholera, or something else, we would want to know. And if there's nothing, you leave it blank. If it's an other that they've been diagnosed with that you feel would be pertinent for us to know, I want you to type it in here. And in this case, I'm just going to type in test. All right, so the next question that we have is, does anyone in your family attend church? And that's either yes or no. If that answer is no, nothing happens. But if that answer is yes, we have a question that asks, what church do they attend? And I just want you to type in the name of that church at that point. All right, so now, let's see. There we go. All right, we're back. So at this point, we've answered that. Now we're at the point of taking a picture of the family. Now the picture is important so that we can show the donor of the bucket filter the picture of the family, and we want that family to be holding the bucket filter with the filter out, and we would like to ask you to have them smile. Sometimes this requires a little bit of coaching, a little bit of fun, a little bit of smiling will go a long way. So all you're going to do to take a picture of the family is click that, and then you will go ahead and take that picture, and then that picture will be saved into the survey, and we can scroll down now and we can see that that picture has now been added to our survey. And then at the very bottom you'll see a check, and if you're ready to finish the survey, you'll go ahead and click that check, and if you're offline, you will see a message that says survey completed, your device is offline, and you will only have an option to send the survey later. But since I'm online and I'm connected to Wi-Fi right now, I'm just going to pick the send later option. Now, one thing I need to tell you is if you did not complete all the categories that you have to complete that are required, it will not let you save that survey, and you'll have to go back and complete that section. So now we've saved that survey, and that survey is in our device ready to be uploaded. And so if you look down here, we used to have just the collect button, but now we have an outbox button. And if we click that, it will open up and show us the survey that we just completed that needs to be sent so we can organize that data. So right in the bottom, if you're connected to Wi-Fi again, and we only leave the devices